Hey, Cancer Warriors. My name is Tanya with Power Pantaloons Podcast, and today we have John Kessler with us. Welcome to the program.
Thank you for having me, Tanya.
I'm so happy to have you here. I understand that you are also a cancer survivor.
Yes, I am. Just quickly about my story. Um, about 6.5 years ago, I turned 50 and went for my routine colonoscopy. And during that colonoscopy, they found that there was a tumor on my transverse colon, which is the part of the colon that kind of runs perpendicular to your body, kind of like as an upside down U. I wasn't expecting it. It was just it took me by shock. I remember getting the call from the oncologist's office, and I'm like, okay, well, what do I need to do next? So they were wonderful. And they
Wait a
said,
minute.
I'm
You
sorry, the gastroenterologist's office.
they told you you had cancer over the phone?
Yes, I'm sorry, let me take a step back. So they found a growth on my transverse colon. They did a quick biopsy of it. It turned out that it was cancerous. So they recommended that I get a surgeon to have it removed as quickly as possible and to find an oncologist. And when I remember getting the call, I was completely overwhelmed. I was like, okay, well, what do I do? How do I do this? And they're like, well, we'll help you. We'll recommend people. So they recommended a surgeon. They recommended an oncologist. This was July of 2017. In September of 2017, I had my surgery. And it turned out that I was stage 3A diagnosis of colon cancer. So after that, I met with the oncologist and we went over my treatment plan, which was to be 3 months of chemotherapy, 4 cycles, where I would have an infusion on Monday and I would start 2 weeks of pills during that time. So I did that for 3 months. The reason why we did it for 3 months as opposed to a longer period of time was my oncologist felt that the results that we would get in 3 months would be just as good as if we did it for longer, but the probability of having residual side effects would be less.
Yes.
So basically I finished my last dose of chemo New Year's Eve of 2017. And that started my 5-year follow-up plan where, for the first year every 3 months, I would go to my oncologist. We would do, blood work. We would do CAT scans. And that was for the first couple of years. And then for the following 2 years, we did every 4 months. And then the last year we did every 6 months. So as of January of 2023, which is when I went for my last appointment with my oncologist, I have been deemed cured. So thank God that I did go for my colonoscopy when I turned 50. Because had I waited longer, who knows, if it would have metastasized elsewhere or would have been worse. So I'm
Yeah.
grateful for um, early intervention, early detection, and the ability to kind of get it taken care of as soon as possible.
Absolutely. It's critical to do that, and I'm glad that you went for your routine examinations. They're necessary, and a lot of people skip them for
Sure.
various reasons, and they should not. My colorectal surgeon thinks I'm absolutely hilarious because I my husband and I do his and hers. It is our every 5 years we do a
Yeah.
date back to back colonoscopies, and our next one is January 9th, which is coming right up. Um,
Sure.
and she thinks it's hilarious, and I he lost his mother to colon cancer, so he is doing on the 5 year plan, and because I had uterine cancer, I'm also on the
Yeah,
5-year
no, I
plan.
mean, yeah, my kids are going to have to do it at 40, if not
Yep.
sooner, because, they've been, my oncologist told me to tell them because it's 10 year, if you're it's 10 years earlier than the diagnosis of your parents. So my kids at 40, if they haven't done them by then, will have to have their first colonoscopies, which is a great thing because again, they're young, they're energetic. Um, so hopefully, God willing, that nothing will come of that. The flip side of it is my mother, who, at the time had never gone for a colonoscopy. Um, because she was afraid to go. She was afraid, she had all these fears. And I basically said, Mom, if me having colon cancer isn't a reason enough for you to go, then I don't know what is, So she did schedule for her, her colonoscopy. They never did it because they did a CAT scan and they found, she was stage 4 ovarian and uterine cancer. So at that point, unfortunately, it was too late for her.
Yeah.
Um,
I hear
so
I hear stories like that all the time. It's preventable.
it is. And so I'm an advocate of, monitoring, doing whatever you can and early intervention to, you know, not to be in the same situation that we found my mother in.
Yeah. I am sorry to hear that. That is tragic. I have my my first mother-in-law um refused to go to the doctor too. The time they found her cancer, it was everywhere. It was in
Right.
her, and she didn't want to go because she didn't want to die in the hospital like her mother did. And that's exactly what ended up happening because she didn't go get checked. And
Right.
you know, it, if I'd called her an asshole earlier, maybe she would have got checked faster. Like that's what prompted her to go. I told her she was being an asshole because, you have kids, like you've responsible, not that your health is tied to your loved ones per se, but it is.
Well, I think, you have a responsibility to kind of, be there. I mean, as parents, I mean, when we're kids, we think our parents are going to live forever. They're
Me
immortal,
too.
right? Um, and as we get older and they're still around, you know, it's kind of like a blessing, but, we could kind of expect it, for them to be around forever. And, when they get sick, it's hard for us to kind of like process that. Like, what happened to that immortality? What happened to, this person that I thought was going to be around forever? And, in my mom's case, her doctor basically, gave her a year, and it was almost a year to the day, until, from her diagnosis till she passed away. So and I mean, and I unfortunately lost my father to lung cancer, and he wasn't a smoker. um but again, he was complaining about chest pains. He went for a chest x-ray, and they're like, you have stage 4 lung cancer. You just never know. And that's the sad thing about this disease. It doesn't discriminate against any type of person, any, race, country, age. We've all had people in our lives that have been affected by it, but,
Yeah.
we can only do, but it's important to take care of yourself. Self-care is where everything starts from,
I,
making sure you go to your
absolutely.
right. I mean, you go to your doctor, like you said, right? You guys do a regular, colonoscopy. I mean, I did 3 colonoscopies in 5 years because of my situation. A year after my surgery, I went back, and, I'm glad they did it, because unfortunately, what they found was where they reattached my colon after removing the cancerous part, it had basically closed up. So I had like this huge stricture that was could have been, I don't want to say life threatening, but it could have been severe.
Yeah.
So I had to have a second surgery to remove that part of my colon. So, my joke is because I've had almost 2 feet of my colon removed, I'm a semicolon. So that's kind of my joke, my icebreaker. But yeah, I went into survival mode. I just did whatever the doctors kind of told me I needed to do. Right. I mean, I don't know about you, but when I was going through my journey, I didn't know like there were cancer coaches or people like, what you and I do who could help us, who could deal with what we were dealing with. Our
No.
friends and family are supportive and to an extent, but they're not dealing with the issues that we dealt with. Whether it's physical, spiritual, mental, and everybody was wonderful, but I didn't have someone to talk to. I mean, even a social worker is not, or a therapist is not someone who's been in our shoes.
My interaction with the social worker that they assigned to me, there was one interaction. Basically, she was like, "So, do you have any questions?" And I didn't, but I didn't know what to ask, and it was like, yeah, it was my responsibility to ask questions, but you don't know what you don't know, and
Correct.
being asked that dumb asinine question, like, wasn't helpful whatsoever to me. I-
Right.
You
No, and
know,
right. Yeah.
it would have
No.
been way better. Here are some resources. Anything like, here's resources on this aspect. Here's resources on that aspect. If you have any
Right.
questions, you could always follow up with me or anything like that. That didn't happen, right? So I like in that regard, I was left in the wind. But
Sure.
and yeah,
No, and
the
and it's true. I mean, like you said earlier, right? We don't know what we don't know, right? And I was lucky. I had a friend who had their own cancer, battle a few years, and they said, you know what, I'm going to go with you to your first appointment, and we're gonna, you're gonna ask questions, and I'm gonna bring a notebook and I'm gonna write it down, right? And anything, you know, you don't know, so you'll have something to recall. But again, I didn't know we don't know what questions to ask, right? And like you just said, resources are a phenomenal tool, and that's one of the things I stress, in the talks that I give and with my clients is education is power, right? Um, when you're diagnosed with cancer or whatever disease it is, that control of your life gets taken away in an instant, right? You're like, oh,
mhm.
you don't know what to do next. Your head is spinning. Um, but when you have the knowledge to kind of know, okay, well, what does stage 3A colon cancer mean? What is my treatment plan? What are my options? You know, what is my recovery time going to be? What are the, residual side effects going to be? That's when you get the control back. That's when you can kind of feel a little bit like yourself, right?
Yeah, a lot of people don't realize that they can get second opinions. They can choose the oncologist. It's not like roulette. You get the one you get, and that you're stuck there.
Sure.
It, it, you know, and having an advocate with you is super important. Uh,
Yeah.
I Yeah, I strongly suggest that. I was also very fortunate. A good friend of mine at the time went with me diagnosis day because she knew, and she was a former RN, and she knew what was going down, and she knew I had no idea, right? Like you have that like fear, but it can't happen to me, right? Like that's the whole mentality. So when my doctor said you have cancer, everything else that came out of her mouth after that was Charlie Brown's teacher, womp 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 womp.
Right.
And my friend was able to take down all the information, and we got back to her place, and she sat me down and she's like, okay, be mad at God, why me's, cry, rage, scream today. This is your one and only day that you're allowed to do any of that bullshit, because tomorrow all of that stops. We're gonna get up and we're kicking cancer's ass. And it was beautiful, right? Because I mean, that's how I would have started my cancer journey anyway, but it was the
Sure.
best gift she could give me.
Oh, definitely. Right. I mean, right. And to your point, when you hear the word cancer and then everything else after that is superfluous, because like you start hearing these words, like you have no idea, no, this noma, carcinoma, whatever it is. I had like a neuroendocrine tumor. That's what my diagnosis was, right? Well, so again, like you hear this, it's almost like you said, it's a foreign language that these
It
doctors
is.
are speaking. And, you know, having the resources, doing the research, it's so important to kind of, like you said, allow yourself to process the wave of emotions and kind of come to terms with it, right? It's like, you have to kind of go through the stages of grief when you're diagnosed with cancer, right? It's a similar kind of sense, feeling, sensation. There's the denial, there's the anger, there's the, depression, there's, um, but that can't, you can't hold on to that. You have to let it go and you have to say, okay, I'm going to fight. Like you said, you made the
Right,
decision, she said to you, you're going to kick cancer's ass. Right. So, all right, well, how do I do that now? Right. What do I do? Right.
right.
How do I come up with that game plan to do that? And it starts with being in a positive mindset. It starts with self-care, right? I mean,
It
it can start with
does.
education and understanding and learning as much as you can about what's going to happen over your cancer journey. So again, you can take back that control and make decisions that will benefit you during that time.
Yes, absolutely. You know, you stop breathing. Like everything is revolves around cancer when your next lab work is, blood draws, your next scan, your next doctor appointment, your next
Sure.
oncologist. And you end up with this whole medical team. Depending on the type of cancer you have. Like for
Right.
me, I had my gynecologist, I had my gynecological oncologist, and then I had my radiation gynecological oncologist. Like it started to get ridiculous, right? Like,
Right.
and so what worked for me and I highly advocate for is creating a medical tracker where you put everything, all of your appointments. I do it. All the appointments go in one spot, and then you have a different spot for your insurance and your pharmacy, and then all your lab results, all your like because when you go to the next doctor, they're going to ask you where you're at, and you just pull out the notebook and you have it.
Sure.
The
Yeah.
last person I saw was Dr. So and so, and this was what he said, or this is what she said. I had my labs over here, and then this is what my blood looks like. Here's my blood results. So you could have a better understanding of what's going on. And
Sure. No. Yeah.
with chemo brain, writing it down in the moment is the only way. It's the only way.
Yeah. Well, it's good, right? Like you said, because it's always good. Like once you kind of get into that, like, okay, I'm gonna beat this, and I'm gonna do this, right? Then you can kind of go back and say, okay, well, the doctor said this. Okay, well, now I can take the necessary steps or take the necessary actions or change my mindset or whatever it is to address those, right? To kind of like, okay, well, all right, so I'm gonna have these side effects when I start my chemo, right? Or I can be prepared that, for me, I couldn't basically eat for 3 months during my chemo. It was just nothing spoke to me. Nothing was appetizing. Um,
You.
it was, four, three, 4 3-week cycles. So for the first, 2 weeks, it was all chemo. And then for the third week, it was no pills. But for those 2 weeks, I really couldn't eat anything. It was just, it was hard. It was hard to find something that would make me, feel good and that I could keep down and just would be appetizing.
All of those things. Yeah.
Yeah, but if you kind of know what, I mean, I remember like they said to me, I don't remember the drug offhand, but they're like, here are the side effects. Well, you can either have diarrhea or you can be constipated. Well, which one would I rather, have? But, you know, but it was just, it's a lot to process. And like you said, you start to get this team. I remember going for my first chemo appointment and I met with, like you said, the social worker. I met with the pharmacist. I met with the nutritionist. And again, it was so overwhelming because I didn't have the questions to ask or the resources to refer to. They're just like, okay, well, this is what you can do. This is what might happen. This is going to be the side effects. Okay, I could be prepared, but I still couldn't process all of it.
No, no. Honestly, it takes years to unpack all of it.
Oh, for sure. And it really isn't until, right. It really isn't until you kind of like are out of it that you can appreciate it, right? That you can, look back on it now and say, wow. But, if we knew now, if we know now, oh, whatever, the
We knew
expression,
then what
if
we
we knew
know
then what
now.
we know now, right? And what we've done in our, in our developing our programs for our clients, yeah, our experience would probably be much different, but we would probably, incorporate some of those things into our journeys and be
Right.
able to handle our journeys a lot better.
Absolutely. And I can give an example to that. 7 years ago, I had a mammogram come back with a concern and I lost my biscuits. They were all over the place. I was stressed. I, I was some kind of way. And, if you don't have cancer, getting an appointment with an oncologist is not going to happen.
Right.
Um, and, and my gynecologist wanted me to take my images to see an oncologist, and I booked the appointment, and it literally was 6 months out, and she's like, "Okay, I'm gonna call the office to talk to them and have them move it up for you." And I'm like, "Awesome." And she's like, "What can I do for you in the meantime?" But I really lost my biscuits over it.
Sure.
Um, Now where I'm at, uh, in the middle of December 2023. So a few weeks ago, I had my routine mammo, and a couple of issues popped, and they want me to go for a diagnostic and an ultrasound. And how I'm handling it this time, light years better with meditation and breath work and working with my tuning forks and doing the Reiki and just being mindful and keeping myself in a positive mindset. I have lost a lot of weight that could absolutely have impacted the scans. So to your point, absolutely knowing what we know now could have
Right.
completely changed where we were then. But hindsight is always 2020. But being
Sure. And
able to
yeah,
share our knowledge now with others who are just now starting the journey, that's gold.
it is, and I wish you all the best. I mean, I hope the results are positive. But like to your point, yes, you have the tools now to handle it in a much better way, and that's really what I think the essence of what we're trying to do as coaches, right? Especially with cancer patients, is to
Yeah.
provide them and give them the toolbox that they need to deal with everything that kind of comes up, whether it's and you know and whatever works for them, and to help them tailor
Blueprint.
their blueprint, right? I mean, yes,
Yeah.
we have a guide that we use for each client, but every client is different. everybody's cancer journey is different. So we have to kind of pivot as our clients need us to pivot, right? But and that's the beautiful thing about, again, because we've been where they are,
Yeah.
right? We've been in their shoes, and that's, I think, one of the things that sets us apart from other types of, life coaches, um, is that, when we talk to people, when we share our story, um, it comes with a degree of authenticity. It comes with a degree
Yeah.
of vulnerability, and people who are in the situation that they're in with cancer were like, "Wow, he gets it. She gets it. She's one of us." Um, I think I was talking or writing something, and I said, um, even though I'm like 5 years removed and I'm declared cured, I'm still part of the family. It doesn't mean that I was never, I'm still a cancer patient. I'm a cancer survivor, but I'm still part of the family. And I'm still where, unfortunately, millions of people find themselves.
Well, according to the American Cancer Society, the current statistic is one in every two people will have some kind of cancer before they
Right.
die.
Exactly.
And hitting the 5 year mark is awesome, but all that means is now you're back in the regular pool, which means you
Right.
have a 1 in 2 chance of having like I just
Right. Yeah.
it's not a great
Right.
pool to be swimming in.
No, it isn't. And people would say to me, I remember, when I was going through, my journey, and people would say, "Oh, your doctor says you're gonna be." I mean, my doctor says you're cured, right? But unfortunately, as you know, and I know, that's not always the case. Once you're cured, it doesn't mean that it's not going to come back. And but that's the thing, do we choose to live our lives with the cloud over our head that it can come
Mm,
back, or do we take that experience that we've had the first time and see how we can make that change in our lives? How can we impact how can we live the rest of our lives differently in a way that brings us joy, brings us satisfaction? Like we've both made the decision to kind of pay this forward by
yeah,
doing what we're doing,
yeah.
and trying to make a difference in other people's lives, right? I always tell
Absolutely
people,
making a difference. Absolutely
correct,
making a difference.
right, right,
Because the experiences that we had and that we talk about and we share, like I talk about because of where I received my radiation, I have poopsidence, and that's kind of humiliating
right,
to be honest. But it's honestly how you look at it. You have the mindset you can't control the situation. The situation is I shit myself. It happens. I can only control how I respond to that. And yeah, it happens in public. So I have a poop sit kit, and we just move on. I clean myself up and I change and we move on with the day. And
right,
before that would have been a I'm not going out limiting kind of thing, but I I can't allow how my body functions to stop me from actually living.
correct,
So if I'm going to be helping others and teaching others how to live in the right mindset, I have to walk my own walk, right?
right,
I can't just be
right. We
talking
have to, right. We
bullshit.
have to practice what we preach.
So we talk about it because it's important to talk about the ugly parts of what cancer can do to you.
Sure.
And even with that and the sexual dysfunction that came along with it, and the fact that I don't have any front teeth, and and all of these other lovely things that came along with it, I'm still exceedingly grateful that I still have this body, right? Because that was not guaranteed. And I mean, nothing is guaranteed. And I feel like I came out of the other side of cancer relatively whole. I don't have a, a uterus. I wasn't using it anyway, right? Like it was it was beyond its point. And so, um, where was I going with this? some people have other things going on with them, and mastectomies, that's amputation, or they have ostomy bags, or
Right.
they're with
Sure.
catheters, and they have to have that for the rest of their lives. I feel like I got out of it relatively easy, even though it was the most brutal year of my life.
Sure. No, and I feel the same way. I mean, I remember going for, you know, when I would go for my, infusions, and I would see, people with ports and people with, who were like wheeled in. And, it gave me perspective. It was like, you know what? Like, this isn't so bad. It could have been a lot worse. And it gave me a huge appreciation for, like I said earlier, catching this when I did. And,
Yeah,
um, but yeah, I mean, to your point, like, you have to make a decision. Do I live, or do I let cancer define me, or do I make cancer just something that um, was part of my story, and I have so much left of my story to write and tell and do, that's the mindset that I'm going to take. And I think what you're saying, that's what you're saying, right? Like, yes, you
yeah,
have these, unfortunately, you have these limitations, but it doesn't define who you are, right?
right.
You're using, it's almost like it's a motivation thing for you to kind of keep going forward, to kind of work towards, helping people. It's like a fuel for you to kind of do what you do.
It is. And you know stop stopping doing things. Like, I didn't realize how much I had stopped doing until I actually started doing my advocacy work, and really working on myself too in the same process, because in
Sure.
order to help people, you have to help yourself, and you have to put the work in, because people aren't going to work with you if they think you're a hot mess. So you have to actually be walking the walk, doing the things that you're saying that you're advising other people to do. And I've only been doing this podcast since May, so 7 months, 8 months now. And
Hmm.
the amount of beauty I have found in other people's stories, and the amount of unresolved stuff that I thought was resolved that's coming up about my cancer story, right? And I'm 16 years out. In March, I'll be celebrating 17 years,
Wonderful.
which blows my mind,
Sure. I mean,
because
well, yes.
my youngest is 18, right?
Right.
So I found a family, and licked
Right.
them. They're mine. And when I was going through my cancer journey, like, they took my uterus out, so I wasn't going to have any of my own kids, right? And so I thought being a mother was completely off the table. And about a week after my fifth cancer anniversary, I started dating a wonderful man who had 3 children. And here I am, a mom. Weird.
Right.
So you never know. You never know. And
Right.
I know that
Exactly.
while you're in the cancer journey, all you can see is the cancer, and you can't see a time beyond it, what beauty might
Right.
be after. And like, no, nobody can promise you anything, but there is life after cancer. For millions of people, there is life after
Sure.
cancer. And having the right mindset from go is super important.
Definitely. And I think that's what we try to do, right? That's what we're trying to do, is to, you know, help our clients create that mindset, because it all stems from the mindset, right? Because like you said, I think you said earlier, you were like, your friend said to you, blame God, curse God, whatever, right? But what is that going to do? That's just holding on to the anger, right? anger is a block. Anger is an obstacle from moving forward, right? So instead, so the flip of it is, well, how does your faith, how do you gain, faith is also something that gives us strength, right?
Mm,
So when I work with clients, that's one of the sessions that we work on is your faith. Like, how do you use your faith to kind of gain strength? How do you use your faith to kind of, move forward? And again, it's changing, the paradigm from, well, why is God is doing this to me, to, well, you know, like you said, sometimes when we're willing and open, that's when the goodness comes. Like you said, you had gone through your cancer journey, and because of what you have done, you were willing to kind of see what life brought to you. And you found this wonderful man, and with him came an instant family, right? So if we're open and willing to receive what our higher power gives us, instead of blaming that higher power, that's when the goodness comes. That's when the strength comes. That's when the mindset changes to, like, okay, I can do this, right? You're not alone.
yeah,
Like you said, we're not alone in this. And or you talked about, doing the podcast, and you know, it's a great thing that you're doing. I think it's important to hear what other people, to get as many people's stories as possible, because, you know, someone could be listening and hear either you or me or one of your other guests say, that's me, like, oh, I'm not alone. Oh, there's other people out there who have gone through or are going through what I'm going through. And again, that might be the thing that turns that switch in their mind from negativity to positivity, right? I
yeah,
wrote recently about, there's strength in numbers, right? And I encourage people to, not isolate, be with your friends, be with your family. It's just as important, but it's important also to be like, find a support group, right? Find some sort of, whether it's online, whether it's at your local cancer center, whether it's, through your town or city or whatever. It's important to share your story. And that's kind of what we're doing tonight, is sharing our stories, because again, someone can hear it and go, oh my God, they're talking to me. I need to do something about this. I need
yeah,
help, you know.
yeah.
So it's wonderful what you're doing. And I'm
Thank you.
grateful for you for allowing me the opportunity to kind of reach people and tell my story, and hopefully, help others.
Well, I think it's super important because there are so many hundreds of different kinds of cancer, right? So
Right,
I know very little about the other cancers, and I know enough about uterine, right? Because that's
right.
what I had, but there's there's so many, and how everybody responds to their treatment and what happens, their symptoms, their just how their body reacts. All of it is different. And learning about resources, like I didn't know that there are volunteer organizations out there that will people will drive you to and from your appointment.
Yes.
I didn't know that until
There are
10
people who
years
will tell.
after I needed it.
Right. And it's interesting you mentioned that, because I've put together a resource guide that I offer. I actually put it on my LinkedIn page so people can download it for free as a free thing. And in there are resources. There's, there's a, each, like you said, there are so many different kinds of cancer, and each of them have foundations or organizations with websites that you can go to. There are, agencies, organizations that can help you with financial aid, with, insurance if you
Yeah,
can't afford. Like you said, there are people who ride. There were people who will come and deliver food for you, do your shopping. I mean, there's airline for, but again, like you said, we don't know what we don't know, right? So that's one of the things I talk about is educating, like I said, educating yourself. And it's not just educating yourself with what's happening. It's, like you said, what are the resources that are available to me? Where can I tap in to get more knowledge, not just about, you know, how long am I going to be out with surgery, or, what is my hair going to fall out? What else is going to happen to me? What are the
Yeah,
long term effects? But what resources are available to me?
yeah,
Are there
yeah.
clinical trials? Are there, are there other,
Yeah, what is even a clinical trial, right? Like what eh, you talk about stuff like that. People don't necessarily know what that, or experimentals,
right,
things that the insurance company are not going to cover because they're experimental, but could save your life, right? New technologies. There's so much to know, and
right,
not knowing the right questions leaves you in a spot. I would be
right.
absolutely happy to put the link to your resource in the show notes for you
All
and
right.
for the audience.
Yeah. I mean, I can email it to you, or, tell me
Yeah,
how you want to
yeah,
do it.
I'll
But
put it in
yeah,
the show notes.
I mean, like I said, when I speak, when I do my workshop online, I offer it to people if they want it. My clients get it. I've now put it on my LinkedIn page so people can get it.
It sounds great.
You know, it is, and and what we were talking about earlier were about, what kind of, you said, you didn't know what questions to ask. So there is a page there about, questions to ask my oncologist. It's not all of them. It's a start. Questions to, if you're going to
Right.
have surgery, maybe questions to ask your surgeon. There's some terminology and some definitions, and there's also, um, things to, like you talked about, like, tracking your, tracking what you're eating, tracking
Yep.
how you're sleeping. Are you exercising? Again, these are things that, this is all about self care, right? And these are things
Yes.
that you can kind of monitor, but it's also important, as you're monitoring those things, that you're sharing it with your medical team, because, like I said, I barely could move, after chemo. I mean, I would, you
It was
know,
brutal.
it was brutal. I used to have to come. I mean, I could only work like half days. So from, like, I would normally work from like 7 to 4:30, or 7:30 to 4:35.
I
But when I
couldn't
was
work
going,
at all.
I tried. I would work. I would get to work about 9:30, but by like 12:30, I was dead. So I'd have to come home and like take a nap in order to get through like the rest of my day.
There's no way. The My treatment plan was so brutal that I could barely. I mean, there were some days I made it just to the bathroom and back,
Right. I mean,
and
every
that was
right,
it.
but
There was no eating. There was nothing. It was
right.
just sleeping 24 hours.
Yeah, I mean, to your right, but those are all right. But those are things that, we need to monitor, we need to record, like you
Yeah.
said, like having all your blood work and all your lab work and all your scans and all of that. But it's also important to kind of see how you're doing with those things, because again, like, you may need, um, if you're not eating, okay, well, I need to, well, your oncologist may refer to you to a nutritionist to say, okay, well, these are the things you should be eating, right? Right.
Yes,
Well, what
and
are the good things? Right. What are the good things to eat? What are the bad things to eat? What should I eat? What should I not try to eat while I'm going through my chemo or my treatment? Right. That's, again, something you don't know.
yeah. Well,
So there, like you said, there's so much to kind of process and to
what you
take
should
in.
eat and what you do eat are two different things, because
Correct.
you have to weigh the, because there's a lot of garbage you eat while you're going through treatment, because it's the only thing that smells good, or it's the only thing that tastes good.
Yeah.
when when you're not eating, you eat what appeals
Right.
to you.
Yeah.
So,
For me,
so
it
you
was
should
chocolate cake. It was
for
chocolate cake.
1,000% you should eat what appeals to you. However, sugar feeds cancer.
Right.
So if you can eat better, you should eat better, but you
Right.
have to do what you can in the scope of where you're at. Be where you're at, because
Sure.
for me, I was nauseous all the time. I didn't have an appetite. I absolutely ate garbage. I don't recommend that to my clients.
No,
I
I
don't
don't
recommend
either,
that to
but
anybody, but
right, but that's why I'm saying, like, you need to kind of figure that out and
pick
talk to
pick your
your
battles.
right,
Absolutely pick your battles. Mindset, nutrition, then the rest of the stuff, right? Like,
right.
because, and I'll be 1,000% honest, I didn't fix my nutrition at all while I was going
None
through
of us, I
my
don't
my
think, right. I think to your point, none of us do.
well, some of the people that I have interviewed, absolutely, absolutely,
Okay.
but those that did usually started before they were diagnosed, right? So
Right,
they have already had a better, healthier lifestyle when it
right.
comes to food and their relationship with food than I did at the time.
Okay.
My relationship with food is much better now, but that's a horse of a different color, right?
Mhm.
So I want to thank you, Jon, for coming on. I really
Oh, this was
appreciate.
great. No, and I appreciate you and what you're doing, and it's hard because there's so few of us who are kind of doing this. It's such a new thing that people don't always know what like a cancer coach is, right? They don't know, they've heard of life coaches or
Yeah,
relationship coaches, career coaches. It's a very small niche that we're in, but I'm glad that there's room for all of us in this
yeah,
niche.
yes,
And there are so many, like you said, there are so many people who unfortunately have been diagnosed or have a loved one who are diagnosed. That the need for us is there.
yeah. It is, and it's not going anywhere anytime soon. I I can't wait for the day that I don't have to do this anymore. But until that day, go, cancer warriors, go get all of your appointments, do
Yes.
your annual checkups, do everything that you're supposed to be doing. I cannot stress it enough. Until next time, bye.
Bye.